Hi, my name is Stephanie Apt. I'm a licensed Medicare consultant and the founder of the Apt Insurance Agency. In today's brief video, we're going to go over Medicare 101, the basics that you need to know as you become a new Medicare beneficiary. Today we're going to talk about the basics of Medicare. Just kind of briefly go over Medicare 101. Medicare enrollment. So your Medicare enrollment window is a 7-month window. It's a period that begins 3 months before your 65th birth month and goes up to 3 months after your 65th birth month. And as long as you sign up before your birth month, generally your Medicare effective date will be the first day of the month that you turn 65. Now, if you're collecting Social Security benefits already, you're collecting Social Security for at least 4 months before you turn 65, the government will automatically enroll you in Medicare Parts A and B. You don't have to do anything. So if you're not collecting Social Security, then you do have to sign up for Medicare, and you can do so a few different ways. You can enroll online. Link here is to ssa.gov, the Social Security website. You can also call your local Social Security office at 1-800-772-1213. You can call them Monday through Friday, 7 a.m. to 7 p.m. Or you can go to your local Social Security office if you want to walk down there in person and enroll right there in their office. Now, when you're signing up for Medicare, what you're signing up for is really A and B. Now, Part A is typically automatic, and Part B is what you're really signing up for when you sign up for Medicare. Part A is your hospital insurance. So, like I said, usually automatic and free as long as you've been living and working in the United States for about 10 years or 40 quarters. Part A, your hospital insurance, helps to cover things like inpatient hospital care, skilled nursing facility care, home health care, hospice. Those are some of the things that Part A helps to cover. Part B, your medical insurance, most people pay $134 a month. That's the standard Part B premium for 2018. Most people pay that monthly to be on Medicare Part B. Now, if you're collecting Social Security benefits, that $134 comes out of your Social Security benefit check. If not, the government will bill you for that $134 per month premium. They will send you a bill. Your first bill will be a quarterly bill, and you will pay that directly to the government for Medicare Part B. You can set up automatic payments and pay however you'd like. Now, Part B is your medical insurance. It covers things like doctor's office visits, anything outpatient, outside the inpatient hospital setting. Part B also covers things like non-self-administered medications, injectables, infusions that you receive in a provider's facility. Those are all the types of things that are covered by Medicare Part B. Now, some people pay more than the standard Part B premium of $134 a month, so this is what most people pay. But if you're considered a high income earner, you may pay more for your Medicare Part B premium. And this chart just shows you based on your tax return from 2 years ago. The government will look at your tax return from 2 years back, and based on your income, they may bill you more. This is also called IRMA, and you may be charged more for your Medicare Part B if you're considered a high income earner. You also may have to pay more for Medicare Part D if you're considered a high income earner, and we'll talk a little bit more about that in just a moment. So once you sign up for Part A and Part B, what are your out-of-pocket costs? What are the medical costs that you have to pay, and what does Medicare pay? Part A pays for some of your inpatient hospital costs, but you still have some out-of-pocket costs that you have to be responsible for. For 2018, there is a $1,340 Medicare Part A deductible for your inpatient hospital stay. Now, this deductible is a benefit period deductible, 60-day benefit period deductible, which means that it renews every 60 days. If you have a long-term stay in the hospital and you're in the hospital for longer than 60 days, days 61 through 90, you'll be responsible for $335 per day of coinsurance. If you're in the hospital past 90 days, days 91 and beyond, for your Medicare coverage, you'll be responsible for $670 per day, and that goes up to 150 inpatient hospital stay days. If you're in a skilled nursing facility, you have a copay or co-insurance for days 21 through 100 of $167.50 per day. So the first 20 days are covered by Medicare Part A. From days 21 through 100, you're responsible for this co-insurance cost share. What are your out-of-pocket costs for Medicare Part B? Well, Part B has a $183 annual deductible associated with it. That's your Medicare Part B deductible. After that, Medicare pays 80% coinsurance up to the Medicare approved amount, and you'll pay 20%. So after the 183 is met, Medicare kicks in 80%, you have to pay 20. And again, there's no cap, no lifetime out-of-pocket maximum there. Because of these kind of big out-of-pocket medical costs that can leave you vulnerable, most people look into some type of supplemental coverage to fill in the gaps and help pay for those out-of-pocket costs that you're responsible for once you're on Medicare. And once you have Medicare Part A and B, you essentially have two coverage choices. I think it's outlined really well here with this flow chart. So you start here, and then you decide how you want to get your coverage. You have option 1 or option 2. And all of the different types of Medicare plans out there really fall into one of these two types of choices. The first option that you have is to keep your original Medicare benefits, Part A and Part B, that you're receiving through the government that we just talked about. And then from there, decide if you need to add on a drug plan, a Medicare Part D prescription drug plan. Now, Medicare Part D prescription drug plans are administered by private insurance companies regulated by Medicare, and plans cover your prescription medications that you pick up at the pharmacy. Medicare Part D prescription drug plans can vary in cost, they can vary in coverage, and we have some more information that I'll link below this video as to how to determine and find and enroll in the best Medicare Part D drug plan for your needs. From there, you'll decide if you want to add on a Medicare supplement plan, also called a Medigap plan. We'll talk a little bit more about Medicare supplement plans in a moment, but essentially these plans are designed to pay the out-of-pocket costs or the gaps that Medicare Part A and B doesn't pay. That's why they're called Medigap plans. These plans really work well at paying the coinsurance, deductibles, and out-of-pocket costs that you're responsible for when you're on Medicare Part A and B. So if you decide to go with this first choice, this first path here, you are getting very complete coverage because these Medigap insurance plans leave you with very little to no out-of-pocket costs. You're paying little to no deductibles, no copays, depending on the type of plan that you choose. Also, you have the freedom to visit any Medicare provider nationwide. If you go with this path, there's no networks, you're seeing any doctor you want, no referrals needed. Now, the other option, option 2, is to go with Medicare Part C. Medicare Part C is also known as a Medicare Advantage plan. Now, Medicare Advantage plans are an alternative to original Medicare. They're not original Medicare. So if you decide to go with Medicare Part C, you're giving up your original Medicare benefits and you're instead choosing to receive your Medicare benefits through a managed care plan, like an HMO or a PPO. And these Medicare health plans are offered by different insurance companies. They have to have at least the benefits of Part A and Part B, and usually have other benefits built in, including Part D prescription drug benefits built right into the plan. Some of the benefits of these plans is that they are very low cost and have low monthly premiums. Now, whichever option you choose, whichever path you choose here, you're still going to be responsible to pay your Part B premium in most cases, that $134 standard premium we discussed. You'll be paying that whether you go with original Medicare or whether you decide to do a Medicare Advantage plan. But with Medicare Advantage plans, they're typically low cost. Some plans start at $0 per month. And they also usually include prescription drug coverage built right into the plan. Some of the downsides of these plans or the drawbacks are that you have to use network providers. So these plans have networks. Some plans have no coverage if you are out of network, and lots of plans require referrals to see a specialist. Additionally, with a Medicare Advantage plan or Medicare Part C, you're going to pay a set dollar amount for most Medicare covered services, whether that's a copay, co-insurance. You have set dollar amounts that you're going to pay for things like inpatient hospital stays, outpatient procedures, doctor's office visits, Medicare Part B covered drugs like radiation and chemotherapy. Usually your out-of-pocket max or your out-of-pocket limit is between $5,000 and $7,000 annually that you may be responsible for if you have a Medicare Advantage plan. So now that we know a little bit about the pros and cons and differences between going with original Medicare plus a Medicare supplement plus a drug plan and going with a Medicare Advantage plan, let's jump back over to Medicare supplement insurance and just talk a little bit more about what you need to know regarding Medicare supplement options. So this here is a standardized Medicare supplement Medigap plan chart. And this is where I always say it gets a little bit like alphabet soup because we have more letters to throw into the mix as if we didn't already have enough confusion between Parts A, Part B, Part C, and Part D. Now we have all these other letters that are associated with your Medigap or Medicare supplement insurance options. But really, there's only 3 Medigap plans that people tend to go with. So let's talk about those 3 plans. And those are Plan F, Plan G, and Plan N. So if you decide that you want to go with original Medicare and add on a Medigap plan, chances are you're going to choose one of these 3 plans. Something that I really want to stress is that these plans are standardized by the government, which means that the benefits will always be exactly the same no matter what insurance carrier you go with. The plans are standardized by letter. So for example, Medicare Supplement Plan F is going to be offered by lots of different insurance companies. No matter what insurance company you purchase your Plan F Medicare Supplement plan through, the benefits will always be identical. They have to be by law. But the different insurance companies charge different prices for that plan. So if you get a Plan F with Aetna, it's going to be the same Plan F as if you got it with United Healthcare, same benefits. But the 2 different insurance companies will charge different prices for that same plan. So it's important to shop around. Medicare Supplement Plan F has historically been the most popular. It's the plan that covers the most. So it's a really easy sell. Plan F covers 100% down the board of your Medicare covered costs. So if you have a Plan F, you're paying 0 out of pocket. It's all covered by your Medicare supplement plan. There's no deductible, no co-insurance, no out-of-pocket costs. All of the gaps in Medicare are being paid at 100% by your Medicare Supplement Plan F. Plan G is rising in popularity for very good reason. It is very similar to Medicare Supplement Plan F. You'll see there's only one difference right here. The only difference is the Part B deductible. Now, everyone on Medicare has that Part B deductible of $183 per year. If you have a Plan F, your plan is paying that deductible at 100%. If you have a Plan G, it's not. So if you have a Plan G, you are responsible for the Medicare Part B deductible. You have to pay that $183 per year deductible when you go to the doctor or an outpatient procedure. After that, though, Plan G works just like Plan F. It covers everything else at 100%. Plan F and Plan G are also the only 2 plans to cover the Medicare Part B excess charges at 100%. The other popular plan that I want to talk about is Plan N, growing in popularity. Plan N is very similar to Plan G. Again, no coverage for the Medicare Part B deductible, so you're responsible for the first $183 of your medical bills. No coverage for the Medicare Part B excess charges. So again, they're very rare to come by, but if you do come by those, Plan N would not cover the excess charges. And Plan N also has co-pays associated. This is what these 2 stars mean here with your Medicare Part B coinsurance or co-payment. If you have a Plan N, you'll typically pay a co-pay when you go to the doctor's office or the emergency room. Co-pays are up to $20 at the doctor's office and up to $50 for an emergency room visit if you have a Plan N. So when you're shopping around and looking at different Medicare supplement or Medigap plans, it's important to look at the pricing of the plans and really to determine which plan is going to best suit you, your lifestyle, and your budget. Since plans are offered by many different insurance companies and pricing can vary greatly from company to company, you want to shop around and make sure that you're looking for a really reputable company that has a great financial stability rating, has a history of low rate increases, and also that has a competitive price point for you. Going back to your other option over here, Medicare Advantage plans or Medicare Part C, those plans can vary greatly from region to region. So Medicare Part C plans are regional, and the plans that are offered in your region may be very different than the plans offered in another region. So you want to shop plans in your area. You want to look at things like doctor networks, which are very important. You want to look at co-pays, co-insurance, and out-of-pocket maximums. It's also important to know that some big facilities like MD Anderson and Mayo Clinic do not accept any Medicare Advantage plans. And another really important thing to note, I've noticed lots of people don't understand this when they are going on to Medicare for the first time. When you first turn 65 or you first add Medicare Part B, you're in your Medicare supplement open enrollment period. So what that means is you can choose either of these options. And if you do decide to go with a Medicare supplement plan, you are in an open enrollment guaranteed issue situation, which means there's no health questions that you need to answer to get a plan. You can choose any plan you want with any company you want, and they automatically have to issue that policy to you. Down the road, for folks that have been on Medicare for a little while, they've been on Medicare for over 6 months and you're outside of that open enrollment period. If you ever decide that you want to move to a Medicare Advantage plan, you can typically always sign up for a Medicare Advantage plan during the Medicare annual election period, which is annually in the fall from October 15th to December 7th. And during that time, anyone that's on Medicare can move on to a Medicare Advantage plan. However, in the future, if you decide that you want to move from a Medicare Advantage plan over to a Medicare Supplement or a Medigap plan, you may or may not be able to, because when you're outside of that open enrollment period, there are health questions that you need to answer to qualify for a Medigap or Medicare Supplement plan. If you're in really good health, you can probably get a Medicare supplement plan at any time, but if you have a chronic condition, you have a pending surgery, procedure, you've just had a new diagnosis, if you're in poor health, you may not be able to get a Medicare supplement plan when you're past your Medicare open enrollment period. So you really want to weigh your options and figure out which option is going to be the best for you now and in the long run. So this wraps up some of the Medicare basics that I just wanted to review with you today, to go over some of the important things that you need to know as you're starting to learn about Medicare and make decisions about your coverage. As an independent broker, I work with all of these insurance companies that offer Medicare plans in your area. So if you ever have any questions about the plans, specific questions, you want to see some quotes or pricing, or you want to know how one plan compares to another, I would be more than happy to answer any questions that you have. You can feel free to reach out to me via phone or email. I'm very easy to contact. And I want to thank you so much for watching. We'll see you soon.